Hi, let's explore OET Reading Part A. In this video, I'll first take you through what OET Reading Part A is, and I'll also show you some techniques in answering these questions. So let's get started with the video on OET Reading Part A. Now, first off, why should you focus on Reading Part A? Well, we know that it is a test which takes around 15 minutes, but these 15 minutes are crucial. If you can get full marks in these questions that you solve in the 15 minutes, then your chance of getting a B grade in reading is really high, which is why it's important to master Reading Part A. So, what is the format of Reading Part A? Yes, in 15 minutes, so we have a total of 15 minutes to solve this particular section, and we have to answer a total of 20 questions. 20 questions in 15 minutes, which simply means you don't have even 1 minute per question. This means you have to be really fast in reading, identifying the answer, locating it, and filling it in where required. Which is why the focus of Part A of reading is locating and recording specific information. Now, this is a skill you will be needing when you're working in a hospital. You will be under pressure, you would have deadlines to meet, but still you should be able to quickly read through reference materials and identify information that is needed for you. Here there are 3 types of questions that you will be answering. 1 is matching question, 2 you will be answering short answer questions, and 3 you will also be answering sentence completion questions. Now, Part A of reading simply means you will have 4 extracts, and based on all of these 4 extracts, you're going to answer these 20 questions. For example, what you can see on screen, it says fractures, dislocations and sprains. So this is the main topic of the text. We have text A, text B, similarly text C and text D. So we'll have 4 texts named A, B, C, D based on the same topic, which is fractures, dislocations and sprains, or any other medical topic for that matter. But each of these texts would focus on a different aspect of that main topic. For instance, if you can look at here, text A focuses on the definition. So what is a fracture and so on. But text B here focuses on simple fracture of limbs. So what you need to do, how you need to manage limb fracture. So similarly, we have a text C and a text D, all focusing on this main topic. So questions will look something like this. I will show you how the questions look like. So this is the crux, or this is the overall idea of Part A of reading. So what kind of texts will you be reading? I said there are 4 texts based on the same topic, A, B, C and D. So it could be descriptions of presenting factors, symptoms and diagnostic tools. This would be one type of question that you would be reading. It could be information about investigations, differential diagnosis, medication tables and dosage charts. Out of the 4 texts given, 1 is likely to be a pictorial representation. So pictorial representation means it could be a graph, it could be a chart. So there is a possibility of dosage charts or medication tables. You might have treatment pathways, options represented as flow charts. So this is also a possibility. You might have instructions about dressing, mobility aids, other devices, advice to give patient on discharge and so on. So these are certain possibilities. Okay. So 4 texts based on the main medical topic. Right? This is how the questions will look like. Let's look at a sample here which says managing diabetic foot ulcers. So we spoke of 3 different types of questions. So this is the first set, questions 1 to 6. This is the matching question type. Why? Because there is some information picked out here and we have to match this information from the text it is taken. So For instance, the first one says how often to change a dressing. Is this information taken from text A, B, C or D? So we identify that, we match it and we fill in the answers here. So if it is text A, we just write it as A. If it is B, we write it as B. For D, you write it as D, and so on. The other type of question here is that you can see 7 to 14 short answer questions. You can see a complete question and a blank. For instance, what kind of DFU is it if a patient has lost all sensation? So we have to fill in this blank by referring to the text and maybe pick out 1 or 2 words which fits in as the best answer. So similarly, we're going to solve up to question number 14. And the last set of questions that you can see, 15 to 20, are completion tasks. So here we have sentence completion question type. So we have around 6 sentences here with blanks. We have to refer the text and fill in the blanks with a word or a short phrase. Check that dash will still go on after the dressing has been applied. So what should still go on? We refer the text, pick the words or one word and fill it in as the answer. Okay, this is how the questions will look like. Now let me just show you how the text will look. Managing diabetic foot ulcers, we've taken the same example. This is text A on that, and the first text is on assessing a diabetic foot ulcer. Okay, so here we have a table. It speaks about neuropathic, ischemic, neuroischemic and so on. Then we have sensation, callus, wound, prevalence. So you have data or information given in the form of a table. The heading here is assessing a diabetic foot ulcer. Text B, you can see, is also about the same topic, but it's about applying dressings to DFUs, diabetic foot ulcer. So we have bullet points, we have paragraphs here. Text C is about debridement of DFUs. So we have 2 short paragraphs given here which has information based on this topic here. And text D is again a table and it talks about dressings for DFUs, the advantages and disadvantages. Like you can see, they have listed out different types of dressings. What are the advantages of those dressings and disadvantages? For instance, it says silver impregnated. The advantage is it is antiseptic and absorbent, but disadvantage is that it is expensive, cost. Okay, so I have information given about diabetic foot ulcer in 4 different aspects divided from text A to text D. So this is how in part A you will have 4 texts based on the same topic and a set of questions 1 to 20 for you to answer. Now, all of this should be done in just 15 minutes. Yes, but what if I say there is an easy way to solving this? Would you believe? Well, today I'm going to show you what that easy method is. And because of that, I've just taken 1 set of questions. So let us focus on questions 1 to 6 here. The first set of questions, and today I'm going to talk about matching questions. An easy method to solve the first 6 or the first 7 questions which fall under this category, matching. Are you interested to find out what that easy method is? Well, let's get started. Okay, first off, what I've done is I've just taken the headings of each text. So what I'm trying to say is, just by referring to the heading itself, you will be able to solve the matching questions. And for you to understand this, I'm just going to show you the headings alone. So you have no access to the complete text. But let's see if we can solve it still. So here we have text A heading which says assessing a diabetic foot ulcer. Heading for text B which says applying dressings to DFUs. Text C which says debridement of DFUs. And text D doesn't have a specific heading as such. But I've just taken the heading of the table which will give you an idea of what is inside the text, like the dressings, advantages and disadvantages. Now I'm going to show you the questions 1 to 6. And let's try and find out in which text would that information fall under. Okay, so the first question says, how often to change a dressing? Okay, where do you think this information would be? Would it be in assessing? Would it be in applying dressing? Would it be in debridement? Or in the advantages, disadvantages? How often, that is frequency. It mostly might be given in applying dressings to DFUs, right? Just from the headings. So let's fill in the answer as B. Let's go to the next question. Ensuring patients understand the consequences of tissue removal. Tissue removal, which one? Applying dressing, assessing, debridement. Now we know debridement means removal, right? Removal of that hard callous material, removal of the tissues. Here we have removal of tissue. So ensuring patients understand, this most likely could be from text C. So let's fill it as text C. What about reasons for not choosing certain products? Of course, immediately we remember advantages, disadvantages. Remember what we read? Cost. Okay. So yes, in that case, this would be text D. The need to monitor a wound. Monitor wound. Would it be during assessing or applying dressing? Okay. Now here we might have a small confusion, but when it says monitoring a wound, why should we monitor? Most likely when connected to dressing. That is, when you're applying the dressing, depending on how bad the wound is, it requires monitoring or you don't have to monitor, right? So the possibility is high from text B. So let's fill it in as text B. How common each kind of DFU is? Which one do you think it will be? A. Assessing. Debridement? No. Applying dressing? No. Advantages, disadvantages? No. It's likely to be in assessing, because it's when talking about assessment of foot ulcers, we might have information on what are foot ulcers and the types of foot ulcers. So, yeah. And how good a dressing is at soaking up a fluid. Soaking, how good? Okay, that means its quality. Quality means advantage, benefit of using it, right? Not the disadvantage. So because we have keywords here, let's say this is from text D. So what have we done here? We have basically solved questions 1 to 6, the matching set, just by referring to the headings, because from the headings we know what to expect in the paragraph or in the text below, right? Assessing a diabetic foot ulcer, we know it will have information about what diabetic foot ulcer is, types, and what you need to look out for, maybe symptoms, signs, all of it is mentioned in assessing. So we know what is the content just by looking at the heading. Now, you might be wondering, we've guessed it, but is it really correct? And for that, I'm also going to share with you the right answer. So let's check how much of it we've been able to crack. So here we have the right answers. B, the second one C, D, B, A and D. Wow, that is wonderful. We've got full correct answers, and that too just by referring the headings. Isn't that an easy way out? Well, trust me, if you try this, it really works. I've tried on a lot of different texts and it really helped me, which is why I thought, why not share it with you as well? So do try this method out and let me know your comments. Here I've just discussed questions 1 to 6 or 1 to 7, the first set for matching. We still have the other types, which are short answer questions and sentence completion questions, which I will be covering in the upcoming videos. Hope this technique will be helpful. Good luck with your OET preparations and thank you for watching the video.
Medcity International Academy. Trusted hands forever.